So it's the holidays, one of my favorite times of year when it comes to seasonal food. Do you have any favorites?
Well, I love cranberries, and pumpkin is my favorite. I mean, I love pumpkin pie, pumpkin bread, pumpkin in my coffee.
Yeah, I'll agree with that. Anything that has to do with pumpkin this time of year, it's that time of year when you enjoy that kind of food.
Well, it is that time of the year when we enjoy seasonal treats, holiday food, and beverages. Overindulging can cause a number of gastrointestinal ailments, including GERD. Dr. Lily Tran of AGSA explains what GERD is, how to manage it, and ways to avoid flare-ups during the holidays and year-round.
Gastroesophageal reflux disease. It is a chronic condition. That is when acid in the stomach refluxes up to affect the esophagus. For example, eating large amount of food at the same time causes the stomach to distend. So therefore, it causes acid to reflux up. It also has to do with the anatomy. So for example, if at the end of the esophagus is the lower esophageal sphincter, if that for one reason or another due to connective tissue disease or prior surgery is quote-unquote loose, then acid can reflux a lot easier. A couple of food right off the bat, which I ask my patients to avoid when they come in. Tomato products, and not the fresh tomatoes, is actually the tomato sauces. So in your lasagna, spaghetti, and pizza. Why? Because when you cook down the fresh tomato with the heat, the chemical bond is broken up, and so therefore it causes the tomato sauces to be very acidic. Now that goes along with citrus, so your oranges, grapefruits. But believe it or not, peppermint can also cause that. So the myth is that when a patient has acid reflux, they may get a bad breath, a condition called halitosis. And so therefore they chew on peppermint candy too, but that essentially makes the acid much worse. And then also chocolate has been blamed on, as well as caffeine. For a lot of my patients, they can do chocolate fine and they may not be able to do caffeine fine. So you have to really individualize. But the common ones are tomato sauces, citrus products, as well as peppermint.
Dr. Tran offers some simple tips to help you avoid GERD, reflux, and heartburn while enjoying a rich holiday menu. Don't overeat. Chances are your eyes are bigger than your stomach. Limit rich foods and alcohol, especially if they are not part of your usual diet. Avoid lying down shortly after eating. Instead, consider a leisurely walk. Chew gum after a large meal. It helps produce saliva, which helps counter the effects of stomach acids. Advanced Gastroenterology and Surgical Associates offer diagnosis and treatment for numerous gastroenterological conditions. For more information about their services and Lake County offices locations, click the Holiday Goodies and GERD Story link at yourhometownhealth.com.